Hello, everyone. We are pleased to share with you key initiatives and highlights of the Ministry of Health's recent activities. Journey with us. During the month of April, the ministry's chronic disease unit successfully hosted the second annual Trainer of Trainers Tobacco Cessation Workshop, geared at equipping healthcare workers with essential skills and upgraded knowledge to effectively assist patients to quit smoking. The training session brought together healthcare professionals from across Region 4 as part of the ministry's ongoing efforts to combat tobacco use and reduce its related health burdens in Guyana. Also in April, 31 persons from sub-districts in Region 9 graduated from a 6-week microscopist training program, in keeping with the ministry's progress in the fight against malaria in the region. At the graduation ceremony held at the training center in Letem, the Honorable Minister of Health, Dr. Frank Anthony, highlighted the region's substantial progress in malaria control. He noted that between 2023 and 2024, the region recorded a remarkable 53% reduction in malaria cases, well above the national decline of 16%. With a current incident rate of just 34.6 cases per 1,000 people, the region now qualifies as a very low transmission zone. Dr. Anthony had this to say.
You will play a very critical role in this march, if you like, to eliminate malaria from Region 9. Each one of you who are graduating here today will have that role to play. So we are depending on you to do your jobs well so that we can remove malaria from this region. We also have been working to introduce some new intervention, and we are going to test some of those interventions in your region as well. So one of the things that we'll introduce this year is something called a malakit. And what is a malakit? A malakit is a box that we have, and in that box we'll have a way of doing a rapid diagnostic test for malaria, and that will tell us what type of malaria that person had, and then it would also contain the treatment.
The ministry reaffirmed its goal to expand malaria elimination efforts to regions 1, 7, and 8, drawing on successful strategies piloted in Region 9. In a call to action for public health transformation, Dr. Anthony underscored the urgent need to prioritize preventative medicine during his opening remarks at a continuing medical education session held on Sunday, May 4th. He highlighted the rising lifestyle-related health concerns such as alcohol consumption, tobacco use, and poor dietary habits as key contributors to the growing burden of non-communicable diseases in Guyana.
But I think also what we haven't emphasized a lot on is in the area of diet, and we have moved away from maybe a traditional diet that was more appropriate for our population, where you had lots of vegetables and fruits, fish in the diet, to one where we're using a lot of fast food and ultra-processed products, which is not necessarily good for our health. So I think the topics that have been chosen are really important ones, and I'm sure that in the presentations we'll learn much more, so that we can bring that back into clinical practice. But on the area of lifestyle and preventative medicine, we think that this is a very important area here in Guyana. And one of the things that we've started to do is to look at a person throughout their life course.
The minister pointed out several proactive steps already taken by the government to shift the country's approach towards early intervention and long-term wellness. Healthcare professionals attending the CME were encouraged to visit the newly commissioned health facilities, including the National Pathology Laboratory, which stands as a testament to the government's commitment to improving health outcomes through innovation, infrastructure, and education. This brings us to the end of the weekend review. Thanks for staying tuned with us. Do remember to visit your nearest health center or health facility to uplift your health vouchers.